Hello, everyone, and welcome to the Miseducation of the American. And I'm really excited to give you a bonus episode with someone who I know and love, Dr. Jeanette. Ooh, is it Dr. Jeanette or is it Dr. Bradley? I see it's on your screen. It says something different.
Yeah.
What do you go by?
I go by Dr. Bradley.
Okay, Dr. Bradley. All right. So, Dr. Bradley, tell us about yourself, please.
All right. So Dr. Bradley's my maiden name. So that was a question. but yeah, so I am Cinnamon Bradley. Cinnamon's my real first name. And I am from Chicago, Illinois, born and raised. Grew up on the south side of Chicago. Yay, south side. Um, and then went to Duke for undergrad. Subsequently went back to Illinois to do my medical school training, and then spent some time in Boston doing some additional training. And turns out after all that, I am an internal medicine doctor. So essentially, I'm a doctor for adults, and I take care of their acute medical problems, their chronic medical problems, try to do as much prevention as I can. That's a really important part of my practice. And I do all that at a place called Grady Hospital, which is a safety net hospital in Atlanta, Georgia. And though I work at Grady, I work for the Morehouse School of Medicine, which is a HBCU devoted to training docs to training docs to care for the underserved. So that's me. I have 3 kids. I have a husband, 3 kids, no dogs, 1 lizard.
You got your hands full. You don't need a dog. Although I'm sure the children will tell you differently, huh?
They have. It's
Yes.
on the way, perhaps.
Yes. The big ones in my house still are asking for a dog. Ugh. All right. Have nothing against dogs. Just don't want any more responsibility. They are enough. So I wanted to have you on, Dr. Bradley, just to talk about the state of the state, kind of almost like a State of the Union. You get to deliver the State of the Union address to us. Just thinking about, especially in light of recent, like the vaccine being announced, and we're coming up on this the turn of the year, which I think some people have this mythical thought that as soon as the clock strikes 12:01, that the disaster that was 2020 will be over, and I'm a little nervous that won't be the case. So I have some questions for you just around that. What are your thoughts about this year overall, especially as a medical professional? Could you just give us some insights about what you've seen this year, the experiences that you've had?
Sure. I will say in sum total, it's been exhausting. I've never had to learn so much in real time. Luckily, doctors like to learn and we're built for that, and we should always be learning. But obviously, COVID-19 has, just changed everything. So just having to learn about the virus, the disease, the treatments, and things like that. And I don't even take care of a lot of COVID patients, but you don't want to be caught unawares. You need to know, you need to be able to tell people, to work with your colleagues and consult. And so just the learning curve, of course, has been steep. And just the way our world is, sorting through information, right? So there's so much information. And even, I kind of keep to what I know is, germane to the kind of medical field and things like that. But, I also like to read mass media stuff. And so just sorting through kind of what's true and what's not, and helping other people kind of understand what's true and what's not, and dealing with the propaganda and the fear mongering and the everything. And it has been exhausting. I know I'm not the only one. I'm sure that's the case for many. There have been cause for hope. My colleagues and I, we really have banded together, kind of protecting each other. Make sure you have your PPE. No, you better do this, you better do that, and so just kind of being responsible for one another. And that's always great to see. And great to feel. And so that's been great. We talked a little bit before about learning how to do visits over the phone. It's not as easy as it sounds, but just learning to kind of do that, because we really had not, Grady, where I work, we really had not stepped into our kind of telemedicine capabilities. So we had to quickly kind of get on board and switch over. And so just being adaptable and learning kind of to switch over and to do, to be able to do those visits over phone, but then knowing when this is not enough, or the person, even just the person, I can't communicate with them the same way, obviously, that I might otherwise. So just learning kind of new communication techniques, knowing who I have to see, and who maybe stay home and it'll be all right. Dealing with the patient's fears, because I've also had patients of I talk on the phone and I say, no, I think you really need to come in. And they're like, I'm not coming to that hospital.
That
Like,
cesspool,
yeah.
huh?
They were like, no, that, and then kind of dealing with that and just being honest about their fears. Cause there was a time within the pandemic where I had the kind of same thought, like, whatever you do, don't go to the hospital, because it's one of my patients said, all the COVID is in the hospital, and so I was like, well, I see how you could think that, whatever. And so just kind of, it's been a constant, for myself and for others, a constant educating and re-educating and trying to do all that with compassion and with humility, because I don't know everything, I wish I did, but I don't know how things are going to turn out necessarily, don't know how things are going to end, but just trying to learn and say, okay, this is a treatment, that we have some information on. Mass has been such a ubiquitous conversation, so trying to learn as much as I can about masks and educate folks what's true and what's not. And yes, you'll still be able to breathe if you wear a mask, I promise, whatever. And so just that process has been just amazing. I try to I like social media, I like using it.
Yeah.
But you
But
have to be
I've seen you on there as kind of a Facebook warrior saying that's not true, or you need to be careful.
yeah. So I've tried to do enough for that, because on Facebook, I mean, those are my family and friends for the most part. I really know, so those are I'm really invested in them being safe and and healthy as possible. So I do try to share, information. I try not to share it with too heavy a hand, because I'm a moderate person in general. There's some things I get more passionate about, obviously, and people's health is one of them. So at any rate, I just try, it's been, we talk about COVID, but as as a social justice woman, as a race warrior, that, all the issues around social justice and race and police brutality and kind of the summer that we had, and trying with those things too, not only as a doctor, but as a mother.
Yes.
And, as a parent, trying to teach my children what this means, teach them how valuable they actually are in the world when maybe they're not seeing that back through the media and through some of the things that are happening to folks who look like them. You,
Yeah,
yeah, it's been a
I'm
year.
glad you said
Nothing
that.
to say much about it other than like, yeah, I'm still here. It's only a few days left, and so God willing, we will make it through this year and get on to the next one, because we have tons of challenges to kind of face and hopefully try to get on top of some of these things. But yeah, that's my long story.
Well, you said something that I wanted to go back to. You talked about being that social justice kind of social media kind of warrior, where you're like, no, what are some of the things that you find over and over again that people have misinformation about that need to be corrected?
Yeah, so even as we get into this thing with the vaccine, of course, so everybody has these thoughts, and really, in all honesty, a large number of people just don't understand certain things about science, and so just trying to teach some basic things, I think. But a lot of people, when they talk about the history of the medical maltreatment of African Americans, it's very true. It's very real. But even in talking about the Tuskegee experiment, they don't know what it is. So they're talking about it, but oh yeah, they injected people with this and they did this. And it's like, that's not what it is. And so I just, Google is free. And so people just need to, and as much as they can before they share information, to educate themselves, the best they can. I mean, that's the least that we can do. You don't want your misinformation costing somebody else, you know, their wellness or whatever the case may be. But again, everybody should really do their own due diligence. But so just, you know, simple things like that. And then just learning too, as a physician, if I'm correcting someone about something like that, I want to do it in a way, you know, that I'm still, you know, with humility, with compassion, and with knowing that I also do not know everything. But it's a journey. I mean, you have to um, encourage people to kind of re-educate themselves. There was another post recently from a nurse, and they were saying, okay, well, why is it that there is a COVID vaccine so quickly and there's not an HIV vaccine? And just so happened that one of my colleagues, who's an infectious disease specialist, had already kind of written this up. And so I shared it with her. You know, I said, check this out. This was really good. I enjoyed this. I learned a lot too, because I did, you know, because I was like, well, that's a, you know,
Yeah.
I was really, to me, that's obviously kind of apples and oranges. It's kind of different, but so just to you know, it's not just in all honesty, it's not just people non-medical world. There are plenty of people in healthcare, you know, who have their doubts and
Yeah. And their own opinions about it,
their,
for
their
sure.
own opinions. And so just trying to get to the place where you can correct if there's misinformation, if you know it is for sure, but also in a way that respects everybody and respects that people are going to have different opinions. So what we're and remember what we're not really overly concerned about people's opinions. So what we want to try to do is stay as factual as we can. Yeah, because
Exactly. And I think it goes back to something you said. Google is free, and probably stay off the YouTube doctors and all of the, like, there, while Google is free, the internet is this abyss of, and we've seen it even enter our political space, where it is this abyss of like crazy conspiracy theories, and it makes you question what's real. I've recently been rather obsessed with BBC World News because I was sick of the the national news scene. And what they said something that was really great. They said, and they were talking about the political landscape, but they said that over the past few years, they've seen Americans gravitate towards fiction as truth,
yeah,
in ways that they had never seen and would have never even thought before.
right. No,
And so I think we're in a state where we're gravitating towards fiction and skeptical of fact.
yeah, no, absolutely. The
That's a scary place.
yeah, yeah. I've also seen some articles talk about the kind of the end of expertise, right? And it's like there are no more experts. So Dr. Fauci, who's been in this for 30, you know, 30 plus years and has a medical degree and all, you know, all these things, like he's no longer any more credible than someone who has no, you know, no medical background,
Yeah.
or they have a medical degree, but they're practicing radiology and really have not been involved in immunology and immunobiology and virology and all these things.
Yeah.
But all of a sudden, they're somehow equal. And, you know, I can listen to both of them with this, you know, and they both have the same amount of credibility. That's dangerous. It's unfortunate, you know, and it's dangerous. And we all know we don't want to talk too much about our current president.
Yeah.
But you know, he's a symptom of that, but certainly has also added to it, you know, in a big
Absolutely.
way. Just kind of the true, you know, the yeah, just what's true and what isn't. So you know, kind of he's a smoke and mirrors type of guy.
Well, I just read something a few days ago, and it was kind of a satirical read about this all began when we didn't push hard enough against the people who said that the earth was flat, that the world was flat. And
Right.
and while it was satirical in nature, I'm like, oh yeah, that's a problem. Like the fact that we didn't that those people were that went on and grew
Right.
and gained traction should have been a red flag that, you know, it's the end of our understanding of science Science, science, science. And I think we know where how that has been able to evolve over the last 4 years. But
Yeah.
again, not giving voice to that political, because I think the problem, a lot of the problem with COVID, and you tell me you're in that space, is this, that it's been politicized
Yeah,
so
no,
much.
definitely. I mean, you see what I started to do early, and what I still do is I read kind of success stories in other countries because I, despite our I still am. I'm an optimist, and I'm still like, but can we just get it under control? And
Mhm.
it's hard to even imagine now because we're in the midst of such a surge in cases. But just reading about South Korea and Vietnam and kind of other, and New Zealand, of course, and other countries smaller than us, but
Mhm.
still with some innovations and some wherewithal and some, courage to make some difficult decisions and do some difficult things. And then what I have found when I was reading through most of those is that it did not become over politicized, and that's how they won, because it wasn't us against them and them against us. And these people believe in this and we believe in this. It was all contact tracing.
Yeah.
It was testing, contact tracing, people willing to give up some of their freedom so that everybody could have more freedom. And really, those, a lot of those success stories, and there are places obviously where they don't have the same kind of political struggles that
Climate.
we have,
Exactly.
but differences, but to be able to kind of get rid of that. But yeah, that is the unfortunate part of what we have seen, I think, for it to become so politicized.
Yeah.
Um,
It's,
that has a lot.
it's
Um,
like it breaks my heart to hear that some people on their deathbed are saying they don't believe that it is real. Or and maybe you can, and I know that this isn't your area of expertise, but I know recently I've been hearing too that, oh, this isn't affecting young people, this is affecting older people, and I'm getting mixed information about that. Do you have any information about, um, just because even as we talk about going back or reopening our schools and things like that, and that's kind of my area, um, the misinformation about whether it is affecting young people or whether it isn't affecting young people is really confusing for the average person.
yeah. So so COVID affects people of all ages. And I should say people of all ages can get COVID-19, the disease or whatever. And so even infants. Luckily, what we have seen is that children do better with the disease. And there are some reasons people think because there are some seasonal coronaviruses, and the virus that causes COVID-19 is a coronavirus. So there's some seasonal coronaviruses that just cause colds and URIs. And so there's some thought that maybe because children have been exposed to those before, they have some kind of baseline immunity that's kind of hard for us to pick up on our tests. But that's possible. I don't think we know all the reasons why. But luckily, children don't do as poorly as adults. And the adults who, there was a recent article I read yesterday too about just young adults. So I think they use between 20 and 45, and
Mhm.
thousands of adults have actually, died of COVID-19. So to say that that's not the case, again, is dishonest. And it really needs to be stressed that it, while it's less dangerous for young, healthy people who are normal weight, there still is a risk. And so, there are thousands of stories out there about my my cousin this, my wife this, my husband this,
Mhm.
and he or she may not have had other conditions, but a lot of times they did. But obviously, the people, very older people and people with comorbid conditions, such as they have severe uncontrolled diabetes or lung disease, heart disease. Sometimes those folks will not do as well. So, but yeah, no, it definitely affects people throughout the age spectrum. And some folk within all those groups, there is some mortality.
What would you say to people who say, I'm not getting that vaccine? Mm-mm, not me. I'm not taking that.
So I've been, people tell me that all the time, and not about the COVID-19 vaccine, about the flu shot. This is not new to me. It's not my first rodeo. So as far as folks not wanting to get vaccinated, it amazes me. It always amazes me um, that no, that probably 50% of the people I see in clinic don't want to get the flu shot. And the flu shot's pretty tried and true. So it's not about it not being around long enough. I mean, folks kind of know what they're getting with the flu shot. So what folks tend to say is, I don't want to put anything in my body that's foreign. So then I have to make sure I be like, so don't drink and don't smoke and don't, don't do all the, but, and so, anything foreign in my body. People say it hurts. And for some people it does. They get a bad, some people say, oh, I got that. And then I got sick. And then I got the flu. So I say, well, it's a killed vaccine. So you didn't get the flu from it, but it could have made you feel sick, similar to what's going to happen when people get the COVID-19 vaccine. It's going to make them feel sick potentially, especially the second dose from what they say. And that's a sign that your immune system is doing something, right? So
it's fighting it.
Yeah, exactly. And so that's not necessarily a bad thing per se, as long as the symptoms are self-limited. So I say all that to say, in medicine, we believe in patient autonomy. So I need to support the patient around what they want to do. I need to educate the patient and help dispel some of the miseducation. So people are like, oh, the COVID vaccine, it's going to change your DNA, things like that. I say, no, it's not going to change your DNA. It doesn't. It can't. That's not what's going to happen. It might be, they want Black people to get it first. Well, I mean, a lot of people, but Black people are unfortunately dying disproportionately of COVID.
Disproportionately, exactly. Yeah. But that's an access. That's a issue. Not just with, that's not a COVID issue. Let's be real. That's an access to quality education and lifestyle and economic issue.
Yeah. So there are so many different things to kind of take into account. But at the end of the day, I just want to give people as much good information as I can, and then they have to make it. I understand this is new to people, but again, my point with the flu vaccine is that some people just don't. There's been such an anti-vaxxer movement in the United States the last couple of decades. So there's already so much misinformation out there. It's hard to overcome all that with something new and novel, so.
And in this time, right?
Right.
In this time where first of all, we've got the internet where we all feel like we're doctors. So you can tell me, but WebMD said, or YouTube said, and this thing said, and we all have this time on our hands, and we all feel like, well, I don't know anybody, or it's just where we're, like you said, where we've all become experts.
Yeah, as I mentioned, I'm kind of moderate. So say in a perfect world, and not a perfect world because we wouldn't even have COVID, but in a world where I was lower risk than I am, like I wasn't a healthcare worker of a certain age, who may have some issues. I might say, well, I'd like to wait 12 months too. I don't feel like we have the luxury of waiting, again, because of the pandemic, and we're about at 300,000 people dead this time. And there are people who obviously, they're the people who are dead, but also they're the people who are living with their kind of post-COVID reality, which includes things like cardiomyopathy, which is your heart doesn't work as well anymore, and neuropathy, which can be painful, nerve-related damage. All, that story is yet to be. Hello? Sorry.
Hi, great picture.
I didn't see you for a minute. That has yet to be fully told. But yeah, I would love to wait and get more data. Doctors.
You're frozen.
Like data, whatever. I'd love to wait and get what I know now, based on the studies. It is safe, and it is. And so does that mean that down the road, when more people are immunized, they won't see some other effects? No. But most of negative effects of vaccines really actually do happen in the first 60 days or so after getting it. And really, even the smaller majority really are in the first 2 days, just kind of these non-severe reactions with fever and things like that. So what I've told people is that, we don't have the luxury as a whole. Individuals may, but as a population, with our numbers and with the number of people who are dying, we don't have the luxury block kind of in a group to just say, let's wait and see what the data shows in a couple of years. It would have been different if we had found some treatments that really were affecting mortality, and we were like, very few people die now. We have this medicine. We don't have those. We do not. We have a few things in our arsenal, and they are not. They're not cure-alls by any stretch of the imagination. There's really been only one medicine, and maybe now there's a new one too, that has been shown to affect mortality. So where people die less if they get this medicine. So there are lots of medicines, and this cuts down your time in the hospital. Well, that's good. There's more beds for other people, but does it stop people from dying of the disease? Because ultimately that's kind of what we're trying to do. And we really have not been able to, find those treatments that really, make the difference and make it less, deadly a disease. And so that's why the vaccine as a preventive tool is so important, to us, and trying to reach again what they say, that herd immunity, so that we can stop the pandemic and get back, hopefully, to our new normal lives, because everything's going to be different.
Everything's gonna be different, but I want to be able to see my dad. I want to be able to I want to be able to entertain and see people I love.
Exactly. It's the simple things, it's not like I want to go to Aruba, but I don't want to go on a cruise. That's one thing. I've never done that. And so now I realize I don't have to do that. But yeah, just simple things. Going, seeing people you love, traveling to see those people,
Yep.
spending time without the mask when possible. But
Exactly.
yeah, I will say the caveat being, though, even though as we get the vaccine, we still need to do all the other things. So we still need to be masking up. We still need to be washing our hands frequently. We still need to be physically distancing from people who don't live in our household. And as much as we can, staying home from non-essential travel and visits. So we still need to do all those same things, even as we start to ramp up the vaccine. Because I would say maybe in the next 6 months, most of the people who want to get vaccinated, I don't even know if it's most, but a large number of people will be able to get vaccinated.
Yeah, I was listening to BBC, and I should probably do more reading on it. But they said that the United States has, they don't, that I think they said will be at 60%, that will have enough vaccine for 60% of the population. And they're hoping for a third pharmaceutical company to start, to go through the process so that their vaccine can be brought to market so that we could have that full.
Yeah, trials are still going on. So they're still doing vaccine trials on new vaccines, and there are different stages. And so that's good. That's exciting. It's gonna be, this company's vaccine and this company's vaccine and this vaccine, and hopefully they'll all be very efficacious. But yeah, I'd be surprised, not surprised. I mean, that'd be good. If 60% of the people in the United States took the vaccine, that would be impressive to me.
Yeah.
That would be impressive.
Well, they said they'll have enough. They'll have enough vaccines for 60% through July, and they're hoping for more companies for their trials to be completed so that they can enter the marketplace, so that we could have more if more people want to do it. I agree, 60% would be a great goal, because and then maybe I'm off in this. Is it 70% to reach herd immunity? I think that's what
Yeah, really what's been quoted, kind of
okay.
65 to 70%.
Okay. What have you learned? What has this taught you as a medical professional? As a medical professional, what has these last, has it been 10 months almost now? 10 months taught you as a medical professional?
Good question. Let me see. So many different lessons, but I mean, again, I think one of the biggest things it has taught me is that I'm not in charge of of everything.
Mhm.
We have our expertise on certain things, but a pandemic comes and it just knocks down kind of what you thought you knew and how you thought things were going to go, and what you thought your interventions were going to do, what you thought modern medicine, could do. And just seeing, how a virus can run rampant. I will tell you, I remember where I was when I heard on the TV about SARS the first time. I actually remember where I was when I first heard about the HIV epidemic, like in the 80s. I was standing in my grandmother's house and I heard on the news, and they said a new, a new virus or disease or of undetermined significance that is killing certain people, in San Francisco. And I was just like, oh my, what are these things, and so and then I'd heard about COVID earlier in the year, but on February 25th, I was in a meeting with someone and they said, no, we need to worry. Like this is real. I think they used the term zombie apocalypse, but I was like,
they're not wrong.
right. I was like, what? But yeah, because again, I was thinking, well, maybe it'll be like SARS, which was just contained to, a certain area. And then when I like, no, this is, because of how contagious it is, because, how borders are so, free and liquid, this is going to come here, and it's going to be bad, and like start having conversations with your family. And I was like, oh, what is going on? And so, but yeah, no, it definitely brings into focus the fact that you are human, and your humanity. I have had times where I had to second guess even my career choice, because again, early on when I felt like doctors and nurses weren't being protected, when I was like, okay, really, y'all, we're going in there with bandanas, like really? I was like, because I'm not doing that, right? It's like because I'm not doing that, and so because that doesn't make sense, and so
no.
just right
here in Illinois, people driving down the highway to broker a deal with a Chinese company to make sure that they had PPE for medical professionals in the Chicago area with a $3 million check. It's just insane.
Yeah, no. It was that time was a really hard time because again, it was a crisis of confidence just from our side, and it's like, no, I don't need to be called a hero. I'm gonna need some PPE. That's what I need. Whatever. And so,
claim your pots and get my PPE. Huh?
Right. So just kind of that, like kind of crisis and like confidence isn't the right word, but just kind of I'm not sure, if this is what it comes down to, I'm not sure that this is really what I want to do, because I need to know that if I'm going to be expected to help and save people, that I have what I need. Somebody has to look out.
Yes. There's a value, right? There's a value for the life of the person who is providing the protection.
And so just going through that phase and then getting to a phase where it's like, okay, it looks like we'll have, enough of what we need. And then getting to the phase where it's like, people, we want to flatten the curve, whatever, and kind of going through that whole phase and thinking we were successful. We were somewhat successful last week, and enjoying those successes. But then you're seeing a kind of a surge goes up. So every day I know how many people with COVID are in the hospital I work at, because we get it now. So just watching those numbers ebb and flow and ebb, and think, and kind of you know, it just tracking that and kind of how that affects kind of how you feel or your mood or how we're doing. It's like, oh, we're not doing as well, or oh, we're doing,
Yeah.
and and there have been some miracles. I had a very elderly patient who came in, who was found to have COVID, and they brought her in, and I just, my first thought, which is a reaffirmation that I don't know everything, and I'm so happy about that. My first thought was, she's not going to do well. I'm like, almost 90, this is not going to go well. Comorbid condition, so many things. She did really well, and I was like, well, all right, whatever. And
Yeah.
no rhyme or reason, I don't know why, but but she did. And she went home and she's spending time with her family, and she, is, enjoying her days. And so, you don't know. And so you definitely have to have that. It's been a time where you understand that you don't know everything, and you have humility, and you just hope for the best, and you work as hard as you can trying to get good results, and you do what you can. You do what you
Do
can.
what you can.
Yeah.
And we do what we can. So as
Right.
you do what you can, then you're counting on all of us to also do what we can,
Absolutely.
to educate ourselves properly, to follow guidelines, and I think there's this larger dialogue about the economy, right? And like these businesses. And I think what people sometimes take for granted is if we do the things that we're supposed to do, then those businesses open up sooner.
Right.
Um, and if our government also participates in the way that they're supposed to participate,
Yeah.
um, that we can that that like you said, our new normal can come about a bit sooner, rather than later if we don't do those things. Well, Dr.
Yeah.
Bradley, thank you so much for sharing your time and expertise with us today. I know that you have little people that you probably want to get to, and some are not so little. So, so I
Someone
appreciate.
away and someone
I know.
all depends.
So, thank you so much, and I really appreciate you.
Thank you. It's been great to be in conversation with you. I look forward to talking to you again soon.